the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Also, we are happy to have Dr. Patrick Flaherty in from Arkansas Heart Hospital, and he's going to talk about the effects of sugar, which we should probably hear today or tonight, on your heart and how it can lead to heart disease. So he's going to talk a little bit. You know, we can't eat like it's Halloween every day and every night.
I know. Sometimes up the entire month we do that. Just have the candy laying around,
right.
you know. Yeah, so this is something to keep in mind, folks, especially all those out there who are very heart healthy conscious.
Right. Back in just a moment, we're going to talk sugar and your heart, how the sugar can affect your heart at next.
Welcome back, everybody. We're so happy to have Dr. Patrick Flaherty from Arkansas Heart Hospital here to tell us more about the effects of sugar on your heart and how it can lead to heart disease if you're not careful with it. Dr. Flaherty, thank you so much for being here. Happy Halloween.
Thank you, you too.
So timely to talk about this.
Absolutely.
Sugar, candy, heart health. This isn't something that I don't think kids need to be worried about right now, right? That's more obesity with, you know, sugars and whatnot. But as we get older and our hearts have taken in all that sugar over our entire life, it can certainly be a problem and something that you guys at Arkansas Heart Hospital have noticed over time, and a lot of research has backed up.
Sure, and we know that it starts early, so it is relevant to the kids, but we kind of have to explain it to the parents and the adults as to the fact that what they're dealing with now probably started 20 years prior to them actually realizing that they have an issue.
Not an immediate thing, something that over time, though, will certainly add up, and that's where adults can find that out later in life, and it's just moderation, right? Is not, if you're not practicing moderation, certainly that can add up and be at a dangerous level eventually.
Well, that's exactly right, and you know we all know that Halloween is the opening day for the holiday carbohydrate and sugar bender that just everybody goes on. Right? It's just the start, and it leads into everything from Thanksgiving on to Christmas and the holiday parties and whatnot. And moderation is the key thing.
Okay, what is recommended in terms of sugar intake for a day, maybe?
It's a whole lot less than you would think.
Really?
And, you know, when you look at men versus women, you know, you're usually talking about an order of teaspoons. And so teaspoons are an easy thing for people to grasp onto. So for an average sized woman, 6 teaspoons or so a day. 9 for men. You probably shouldn't think so much about the actual number of teaspoons, but if you realize that that's just a can of Coke.
That amount?
Yeah.
It's just one can?
For the entire day.
That's it?
Yeah. And you've already exceeded it if you've gone past, you know, just having a single can of 12-ounce sugared drinks.
Yeah, and you know, those sodas, and a lot of them, their big marketing technique is low cal is what's been found to be a really big problem with
and sugar is actually remarkably low in calories, but the way that it works is it causes insulin surges, and where insulin goes, that weight accumulation is going to follow. The connection between sugar and coronary artery disease in particular isn't very direct.
Okay.
It goes through things like obesity and diabetes, which then are the more long-term components of the things that we deal with as far as risk.
Okay. You talk about what people usually take as their sugar for a day, and they get it just in that one soda can, period. But it can come from other things too, and before people realize it, it's already over in just one day. They've had it in the morning.
Absolutely, and I mean we had the same discussion regarding sodium. It's everywhere. It's you don't even have to look for it, and you've already probably surpassed your intake for the day. Particularly if you're eating out a lot, eating a lot of processed foods and those type of things that are going to have flavor additives in them, and that's usually going to be in the way of sugar and sodium.
What are some of the things people should do if they start to feel any symptoms of heart disease? What are some of the first things they should do? Consultation, I imagine, number one, to figure out, you know, where to go next.
They kind of have to look at the big picture, but usually starting with your primary physician or primary care provider, whichever it is, you need to at least discuss those things with them, because sometimes the things that you're worried about aren't really that big of a deal. Sometimes there might be something very, very small that turns out as a much bigger problem. So, you know, speaking with folks who are aware of the issues is clearly the way to go, rather than ignoring it. There's never a dumb question on those lines. I mean, you just got to play it safe.
Okay, play it safe. don't play with your health. Don't do it, folks. Go see the folks at the Arkansas Heart Hospital. They'll take great care of you and make sure that you keep on moving, keep on living your life, and of course, make sure that you stay healthy for years to come. Dr. Flaherty, thanks for coming in
Thank you very
today.
much.
Happy Halloween to you.
You too.
Appreciate you stopping by. A very timely subject, as always, as they are over there, making sure that we talk about something that's relevant in candy today, sugars especially. And he just mentioned it's only the beginning, folks. Thanksgiving is just less than a month away.